I am Dr. Kelly Okbagu. Let me tell you how we ended up creating a quality improvement project about snake bites. A patient comes into our hospital with a suspected coral snake bite. Now, snake bites aren't exactly an everyday admission of our internal medicine residents, and coral snake inflammation is even less familiar. So immediately we're dealing with something rare, potentially serious, and an outside the normal of our rhythm in patient services. And this is where the story gets interesting. Somehow along the way, the search begins for coral snake antivenom, not through the pharmacy, but through the Dallas Zoo. And somehow, antivenom makes its way from the Dallas Zoo to our hospital. There's just one small problem: it's expired. At this point, we have a patient with a suspected coral snake bite, expired antivenom from the Dallas Zoo, and pharmacy hasn't been involved. If this is starting to sound less like a routine hospital admission and more like an opening scene from a medical drama, that's pretty much how it felt. Then poison control gets involved. They review the situation and recommend not giving the antivenom, which was an especially important recommendation considering the medication involved was approximately $250,000. So let's recap. A suspected coral snake bite, expired antivenom, from the zoo, no pharmacy involvement, poison control ultimately says do not give, and roughly $250,000 in medication is sitting in the middle of the story. At this point, we had two choices. We could call this one of the bizarre cases everyone talks about for the next 10 years, or we could ask why our system allowed this situation to unfold this way in the first place. That's where the project really begins. The problem was that when a rare high-risk event occurred, our system depended on people knowing what to do without giving them a standardized way to do it. We had no standardized inpatient snakebite protocol. We had no quick bedside identification resource, and there wasn't a clearly defined process for when poison control and pharmacy needed to enter the picture. So our goal became very simple: turn uncertainties into readiness. Moving into the center of the poster, you will see how we tried to do that. We brought together medicine, pharmacy, nursing, emergency medicine, and our regional poison control center to create a standardized clinical pathway. The protocol takes the clinician from stabilization through focus assessments, severity situations, laboratory testing, and serial reassessments, early poison control consultation, treatment recommendations, pharmacy involvement for antivenom selection and procurement, and finally, disposition. This isn't intended to turn our residents into snake experts. What we are trying to create is a reliable clinical response when the person treating the patient may have a very little previous experience with snake inflammation. And that brings us to our most important practical part of the intervention: the badge buddy. The front gives residents an immediate visual reference for venomous and non-venomous snakes encountered in East Texas. The back puts the clinical pathway right at the bedside, assess and monitor for the patients, and contact poison control early, involve pharmacy, and coordinate antivenom decisions appropriately. We wanted something residents could actually use during an encounter, not information buried somewhere in the hospital's archive requiring 3 passwords, a treasure map, and a defined intervention to locate. On the right side of the poster is how we will determine whether the intervention works. We'll use a pre and post intervention assessment to evaluate residents' knowledge and confidence, with our primary outcome focused on improvement in both areas. We'll also examine protocol adherence, appropriate antivenom utilization, reduce unnecessary preparation and medication waste, and improved interdisciplinary communication. Medication stewardship is particularly important because our Sentinel event demonstrated rather a spectacular antivenom decisions can have very expensive consequences. We can't make snake bites routine, and we prefer not to, but we can make our responses routine. Identify the problem, follow the pathway, call poison control, involve pharmacy, and provide the right care. And that's exactly the outcome we are looking for. Thank you.